Hello, I'm Dr. Sujit Jos, consultant orthopedic surgeon of PVS Memorial Hospital, Cochin. Sports injuries. It is a subject which has become quite important in the modern youth. Like we are more involved more in active sports like football or cycling, skating, jumping, mountaineering. So it gives a lot of stress to your joints like the knee joint, the shoulder joints, the hips, the ankles. So the most commonly injured joints are the knee joint and the shoulder joint. The ankles, yes, and the wrist gets sprained, but then they recover and they usually don't require any active treatment like medical help is not required, like a bandage or a primary care is usually enough for a twisting injury of the ankle or the wrist. But then inside the knee joint, most of us would have heard about the meniscus injuries or ligament injuries. So what is a meniscus and what is a ligament? So that is a model of a knee joint. So that's the bone above and the bone below, femur and the tibia. That's a small bone called the fibula. And you got a cushion in between the bones called the meniscus. And there are ligaments, that is, they are rope-like things which connect the bones together. There is a ligament in front called the anterior cruciate ligament or the ACL, and the posterior cruciate ligament called the PCL. There are two other ligaments outside the knee called the medial collateral ligament and the lateral collateral ligaments. So these don't often get injured. So the most common injury you see are the menisci, the medial and lateral menisci, and the anterior cruciate ligament, the ACL. You heard about the ACL tear. So what happens is the ligament has to hold the bones against each other and prevent a slipping of the bone against each other. So if the ligament is torn, the bones can move more. Normally the movement should be less than 5 millimeters. If it is more than 5, if the ligament tears, the tibia can move anteriorly more. So it can move by 10 millimeters or 15 millimeters. So if it moves more, what happens is the knee twists. Suddenly when you go downstairs or when you play, the bones can twist against each other or slip against each other. So what happens then is the meniscus, the cushion, can get injured because of that movement. The cushion in between is crushed in between the bones and it tears sometimes. It's a rubber-like thing. It can heal in some people, but it does not heal in many people. So when the meniscus does not heal, the knee becomes painful and swollen whenever you play, or the knee clicks or makes sounds or gets stuck sometimes when the knee moves. Similarly, when the ligament is broken, again the knee moves and causes effusion inside the knee joint. And you can see there might be cartilage injuries when the knee bones rub against each other. So how do you correct that? What we do is, for the meniscus, there are arthroscopies. So knee we don't open now like the shoulder joint. We can do everything by mandar, like arthroscopy. By keyhole, we go inside and we try to correct the problem inside, like the meniscus tear. If it is in the peripheral zone, we try to stitch it back. If it is the inner zone, we try to balance that. Whatever problematic piece is there inside the knee joint is cleaned, and so that the bones move against each other. So whenever there is a chance to repair, that is where there is blood flow, on arthroscopy we can see the surface of the meniscus. If it bleeds when you touch, it means it will heal. So you try to push it back and stitch it by special stitching equipments called the fast fakes or the cinches. So the meniscus can heal. So you need to give some rest to the knee joint until it heals, and then you can get back to normal activities like the knee was functioning before, like 3 months later or 6 months later, you can resume football and other games. So the ligament, when it breaks, so meniscus is a little more easier to correct. The ligament is a little more bigger problem. So we have to put in a new structure. The ligament does not heal because it is like 1,000 or 10,000 fibers inside that rope-like thing. So when that ligament breaks, it is the fibers are all scattered and they never usually come back and stick. So they just stay there and the knee becomes unstable. So what we do is we take a hamstring graft. There are different types of grafts we can take. The most common one we do, which is very strong and helps the person to get back to active sports, is the hamstring graft. That is, there are the tendons on this side of muscles called the hamstring, the semitendinosus or the gracilis. We harvest one of them and we make small drill holes in the bone, in the tibia and in the femur by arthroscopy, and we pass this graft inside and fix it above and below. Above, it is usually done by a tilting loop-like mechanism called the endobutton, and below it is best fixed by an interferential screw. That is a screw which can go beside the tendon and fix it inside and make it strong. Just like the ACL was functioning before, the ligament can be recreated and the person can get back to active sport. But without the ACL, I've seen a lot of patients who have come with the ligaments torn. They feel that when the ligament tears, it causes some pain, but after that the pain settles down. When the pain is not there, the person feels okay, the knee is fine, why should I get a surgery done? But then after some time, when they start playing or when they twist the leg, the knee causes a fusion, and multiple times when it happens, it causes damage to the knee joint. It damages the cartilage or the meniscus, and that is a permanent damage, some damage sometimes, and that is what has to be prevented. So an early detection of this problem and correction will restore your knee to almost near normal activities, like it is more than 95 or 97% successful, and the person can get back to sports in 3 to 6 months time. In 3 months time, I say the person has to use a stick for 10 days. In 10 days, the person can start walking without a support. 6 weeks, you have to wear a brace to prevent the knee from moving, and till the ligament heals inside, you have to wear a brace. You can walk normally. In 3 months time, you're ready to jog and do light activities. In 6 months time, you can start active sports, and usually 6 to 9 months, most of my patients get back to their active pre-injury levels. The second type of injury we're talking about is of the shoulder. The shoulder joint again has these ligaments and supports which hold the bones together. So that is a model of a shoulder joint. So that is the scapula, the shoulder blade, the shoulder ball. So the ball articulates on the shoulder cup and moves in different directions. That is why we get different directions of movement, and it's a very mobile joint. Similarly, and due to that problem, the joint is an unstable joint, we say. Like it can slip very easily. So the most common injury which comes in a younger person who plays is when a person plays, the shoulder joint can move in an abnormal direction and pull off these connections. These are called again the ligaments inside the shoulder joint, which connect the ball to the cup. So it can tear and cause an instability. So when you pull hard, a doctor pulls hard, or someone helps the person to push it back, the ball comes back into position. But this tear stays like that for many people. So the moment it dislocates again, or when it dislocates, first what you have to do is give some rest, give some ice, put it back in position, keep the hand at rest for 2 to 3 weeks, and then start moving the shoulder joint. So after 6 weeks, 2 months, you have to test the joint to see if it is unstable again. If it is unstable, like you get pain when you do that, that means the shoulder ball might dislocate outwards, or it is pushing out. So you have to do an MRI to confirm whether the labrum has torn from the cup. So if it is torn, that means it may not heal now. The healing capacity of the body is usually in the first 6 weeks or 8 weeks. After that, it seldom heals. So we can aid it by putting an arthroscope, a keyhole inside, and we can stick this back with small equipments called anchors. They are small pin-like things which go into the body. They are absorbable anchors with some threads attached to them, and we have some arthroscopic knot tying equipments to tie these knots onto that and cut it off, and the labrum heals well onto the bone. After the labrum heals, the shoulder becomes just like what it was earlier, and the person can start all normal activities. 3 weeks we say keep the hand in a sling. After this, just have to be in the hospital for a couple of days. Second day, usually you send the patient home. You start light movements, except this type of movement. Abduction you prevent to aid in the healing, or wait till the healing has completed. In 6 weeks time, usually the healing has completed almost 90%. In 3 months time, it is 100% healed. Then you can start moving your shoulder, rehabilitate your shoulder by doing some exercises which we usually teach for the shoulder rehabilitation. And then in 6 months time, most of the patients get back to active sports, including badminton or throwing activities. And that is how the shoulder dislocation is treated. The other injury which can come is a rotator cuff tear. Similarly, the muscles which move the shoulder ball, the muscles on top, these are the rotator cuff muscles. They can tear sometimes due to heavy lifting or sudden falls. This usually happens in older people, not in very young people. Older means after 40, 45 or 50 years, or 40 to 60 is the age where we commonly see rotator cuff tears. When it tears, the shoulder becomes weak, so you may not be able to lift something up. So the hand, when you aid it to go up, it can move above your head. But then lifting something up from a position down to about 70 degrees will be very difficult or painful when the rotator cuff has torn. So that again can be seen on an MRI. And then if it is torn, then what we do again, just like we did for the dislocation, we can repair this with anchors. There's small 5mm bits which go into the bone, which gets absorbed after some time, and you stitch it back into its original position, and the shoulder gets its ability to move, and the muscles are able to lift the shoulder up after a while, after this has healed completely. And the rehabilitation again takes 2 to 3 months, when you should not lift weights, but then you can start doing all normal activities in 3 weeks time usually. And after 3 months or 6 months after the healing has completed, you are ready to do almost all normal activities, and it's again a successful procedure. And you have to treat the cuff tear with the good type of anchors. Like there are single row repairs, double row repairs. So it is dependent on the type of tear and the dimension of the tear. For a large tear, we always try to do a double row repair, or a speed bridge, or a crossed fixation, where small anchors will be put in the first row, and then those knots are pulled downwards and fixed again with other small anchors, so that the footprint is pressed onto the bone and it heals very strongly, so that you get normal activities. It's up to the surgeon to choose the best for you, and the results of a rotator cuff repair are really good and gratifying, with the patients getting back their normal life again. Thank you.